Well, now another COVID-19 vaccine is under scrutiny after a few cases of blood clotting. US health authorities have recommended a pause in the use of the single-shot Johnson & Johnson jab as it investigates those incidents. The Food and Drug Administration has stressed that this is a precautionary move, but also in the past few minutes, the company has announced it will delay its rollout in Europe. Well, we'll be speaking to Stephanie Decker in Berlin to get more on that in just a moment. But first, let's speak to our White House correspondent, Kimberly Halkett in Washington, D.C. Now, Kimberly, the government there has already been struggling to deal with vaccine hesitancy. I don't imagine this whole Johnson & Johnson situation is going to help much with that.
Well, the White House has just released a statement saying that they believe that the pause in the Johnson & Johnson vaccine being administered in the United States that has been recommended by the CDC as well as the Food and Drug Administration won't have a significant impact on the overall vaccination campaign. To put it into context, the White House saying that the Johnson & Johnson vaccine made up just 5% of the vaccines being administered. The majority of vaccines being administered in the United States are made by the drug companies Pfizer as well as Moderna. Now, the White House saying just moments ago that the Pfizer and Moderna doses, that they have secured enough to administer 300 million Americans shots. So they do believe that they will remain on track for the revamped goal of 200 million shots administered by 100 days in the Biden administration's first days in office. So there is still a sound of optimism despite this, what is being viewed as a setback for the global vaccination effort and also the effort in the United States. The concern being that while it is a small number, that the effects of the Johnson & Johnson vaccine that could cause potentially a very serious blood clotting disorder. In other words, what they call a thrombotic event or CVST. Now, what we know is this has happened primarily to women between the ages of 18 and 48, but less than a dozen cases. Still, out of an abundance of caution, this is being reviewed by the Centers for Disease Control on Wednesday, and the recommendations made by that body will be presented to the Food and Drug Administration. But again, out of abundance of caution, this is being paused. But the White House saying this will not have a dramatic effect on the vaccination effort in the United States.
Kimberly Halkett there, our White House correspondent with all the latest. Thanks so much, Kimberly. Well, let's now go over to Europe and speak to Stephanie Decker in Berlin. Steph, over there, first AstraZeneca and now Johnson & Johnson, another setback for the continent's vaccine rollout?
Absolutely. I mean, across Europe, the vaccination rollout has been sluggish in some areas, a little faster in others. But certainly when it comes here in Germany, it was a slow start. Certainly, they were expecting the Johnson & Johnson vaccine to arrive here mid to late April. Europe has actually bought around 2 million doses of the Johnson & Johnson vaccine to be distributed among its member states. So there hasn't been any official reaction so far, but certainly just from reading between the lines, of course, this is going to dent what has already been a sort of slow vaccination campaign. What's better about the Johnson & Johnson vaccine, so to speak, in terms of time, is you only need 1 doses, whereas the Pfizer vaccine, the biotech Pfizer and the Moderna one need 2 doses administered from a couple of weeks from each other. It's also easier to store. It can be stored in a normal refrigerator for up to 3 months. So these are the things that make it more of a let's say, attractive vaccine when you're trying to get your population vaccinated in a fast amount of time. And certainly we were talking to the head of the medical practitioners here earlier today, and he was saying one of the key issues was the fact that they were lacking vaccines, and they needed to get more vaccines into the country to be able to vaccinate people at a quicker pace to keep up with what is now a third wave here in Germany. So certainly this news that fine, out of abundance of caution, Johnson & Johnson is stopping its deliveries, but it's only going to slow the vaccination campaign even more.
And Steph, you mentioned that third wave happening now in Germany. The country is also now trying to centralize its pandemic response there. How is that all going over?
Yes, this is basically because the German Chancellor Angela Merkel has been frustrated. She's been trying to impose stricter lockdowns. She's been talking to the 16 heads of the regions in Germany, and what's happened over the last couple of weeks is that they've been implemented to varying different effects across the country, regardless, let's say, of some areas of increasing numbers. And we've had warnings from different medical heads and voices and even politicians over the last couple of weeks that if stricter lockdowns do not get implemented, implemented, that the third wave of this pandemic will increase, that hospitals will get overcapacitated, that ICU beds will get filled. So this is the concern. So what they've done now is they have passed through the cabinet legislation which would give the central government absolute power to impose these lockdowns on the different states. It still needs to pass through Parliament, but if that passes, and we're looking at that potentially later in the week, but it needs 2/3, then the central government can impose things like nighttime curfews from 9 p.m. to 5 a.m. It can close schools if the numbers go up to a certain extent. It can impose that only families from one family can only see one person from another family a day. I think it's very difficult to impose, but these are sort of the measures that they're looking at.
Stephanie Decker there across all that for us from Berlin. Thank you so much, Steph.